Thank you, Madam President, and good afternoon. As of today, we have over 690,000 deaths across this country due to the COVID virus. We have 8,593 of our state residents who are no longer with us because of COVID. Since the July special session, we've had 311 deaths here in the state of Connecticut. Mothers, grandmothers, fathers, cousins, aunts, uncles. Sure, we can all name someone who is no longer with us and families who've been affected by the coronavirus. Since our July special session in the United States, we've been having, unfortunately, 2,000 deaths per day. That's over 83,500 deaths. And those numbers indicate to me that it seems like we should act. We need to continue to treat this pandemic with the seriousness it deserves and the severity it warrants. I know many parents right now who believe that this is an emergency because their kids cannot get vaccinated. Parents who are sending their kids to preschool or from kindergarten through end of elementary school, who are nervous each and every day because their kids cannot get vaccinated. They believe that this is an emergency as well. So we have to treat this with the severity that is warranted here in Connecticut and around our country. We've set up a system in place that has checks and balances, that includes the executive branch and the legislative branch in making decisions on executive orders, a system that wasn't even in place prior to May 17th with the passing of Public Act 21-5. But even prior to that, because of the fact that COVID is striking so many people, that it is taking lives and affecting and impacting families, that we now have to continue to have the executive orders in place. But prior to the Public Act 21-5, it was much more of a system where the executive branch had more of the control without the input of the legislative branch. So there were times where we would affirm the governor's orders. But now, with Public Act 21-5, the 6 leaders can veto any of his executive orders after 36 hours. For the benefit of anybody who's listening, we have had, no one has asked, as far as I know, to have a vote on any of the executive orders. And we've certainly not vetoed any of the executive orders because they make sense. They help keep the people of the state of Connecticut healthy and safe. And we've seen that in the results of the coronavirus and our own statistics. The governor's executive orders and emergency powers were even challenged prior to Public Act 21-5 by the Connecticut Supreme Court. They're challenged and ended up in the Connecticut Supreme Court, where it was affirmed that the governor had the authority to make these decisions. On March 29th of 21. As a matter of fact, interestingly, on March 29th of 2021, in upholding Governor Lamont's emergency powers as constitutional, Justice Andrew McDonald quoted President Trump's declaration under the Stafford Act, stating that COVID-19, quote, causes damage of sufficient severity and magnitude to warrant major disaster assistance. Those are President Trump's words, cited by the Connecticut Supreme Court by Justice Andrew McDonald. So, Madam President, we know that we continue to have work to do in this crisis that we're in, and to continue to keep people healthy and safe here in the state of Connecticut. Madam President, unfortunately, we've been through this a number of times where we have people who continue to say that there is no emergency, even though we know for a fact there is an emergency. Back in the springtime, when we were here talking about whether or not in July to extend the governor's executive orders, we heard many times that we should not extend those orders. July 9th, we had people saying here, we are well on our way to recovery. You heard people say, there is no current emergency, not an actual or true emergency. And at the time, COVID looked like it was almost in the rearview mirror. People were getting vaccinated. Spring was coming, or spring was here, summer was here, and we're hoping that the worst was behind us, not knowing that the Delta variant would literally hold on and grab us over the summer and become the dominant variant and be so deadly over the last few months. We heard others say the pandemic is clearly waning, or I just don't believe that emergency situation, that's a call of action under civil preparedness, or the emergency has waned. I can see the end of the tunnel. I think we're pretty much out of the woods. I think it's better off for society that we just get on with it. Thankfully, this body and the House had the wisdom to continue on with the emergency orders so that we can keep people safe. And it bears out in the data of low infection rates, lower hospitalization rates, higher vaccination rates. In fact, it seems like people who were talking about how well Connecticut is doing are now arguing against continuing the very things that have kept us safe over the last few months. You know, I get concerned because, again, we look at the number of deaths we've had in the country and in the state, about the parents who are nervous about the fact that their kids are not vaccinated because they're not eligible yet, the fact that we continue to have debates over masks, whether they work or they're effective, after study after study after study after study shows that they indeed work and they're effective, and that we need to allow the ability for safety in our state. And I just want to mention a few more pieces of data, if I may. Because of the precautions Connecticut has taken, our 7-day average of new pediatric hospital admissions in the first 2 weeks of September were only between 1 and 2 children. We cannot say that in the rest of the country. We literally have pediatric units in other states with low vaccination rates for adults, where pediatric units are filling up. Why? Because the Delta variant is so strong and so contagious that those of us who are vaccinated have more ability to obviously not get the disease, but it unfortunately falls to our youngest. Connecticut's COVID test positivity rate for the first 2 weeks of September was 3.4%, amongst the lowest in the nation. By comparison, over 20 states had rates of 10% or more. And according to an OLR report that I asked for, Connecticut is one of 17 states with a statewide mask mandate for schools. There are 10 states that have banned local mask mandates for schools. Now, here's some of the data that I think is interesting, which makes the case as to why we need to continue in the course we have been on these many months. Connecticut has a lower incidence rate of COVID and a lower number of pediatric hospitalizations than all these states. Connecticut, during the first 2 weeks of September, had 2 reported school closures and no district-wide closures during this period. But you can't say that amongst the other states. In Montana, where they have a ban on local mask requirements by the state health authority, 1 school is remote and 6 other districts have closed entirely or went remote. And those districts in those states are big. It's not like the little districts we have here in Connecticut. In Oklahoma, there's a ban on local mask requirements by the legislature, and over 20 schools have gone remote or closed among 18 districts. Over 20 other districts entirely have gone remote or closed. In South Carolina, a ban on local mask requirements by the legislature, 13 remote schools among 12 school districts, or 3 other districts entirely remote. In Texas, a ban on local mask requirements by the governor. Over 20 schools remote or closed among 17 districts, and over 40 other entirely closed districts. When we talk about in this circle on both sides of the aisle saying how glad we are that our schools are open in this state, and how actually for the first time ever, maybe in history, where kids are saying, I'm so happy to be at school. When in these other states where they're not taking health and safety as seriously as we are, and I would submit acting irresponsibly, you see schools closed, remote, you see kids in the hospital, and unfortunately some kids are dying because of COVID, because of irresponsible governing, the fact that they're not doing what they need to do based on health and science. 2 studies that were published Friday, September 24th by the CDC shows that masks protect children from the coronavirus even when community rates are high. One study conducted in Arizona when children returned to school in July found that schools that did not require staff and students to wear a mask were 3.5 times as likely to have a virus outbreak as schools that required universal masking. And the second study looked at infections in all 520 counties in the U.S. and found that pediatric cases increased at a far higher rate in counties where schools did not require masks. Again, we want our kids to be back in school. I want parents to feel confident, even those kids who aren't able to get vaccinated yet, to feel confident that we are doing everything we can to keep those kids safe and healthy, even if they cannot get vaccinated yet. It's really important that these kids stay in school and that we're doing everything we can to help that. So, Madam President, I think with the data that we're seeing, with our high vaccination rates, our low infection rates, with the fact that we know that based on studies that mask requirements work in the schools, that they keep our schools open, that the governor needs the ability to have these limited executive orders so that the people who are over 65 now can get their booster shots quickly, that schools can stay open, that we can have the requirement for healthcare workers, state workers, and others to get vaccinated or take tests, that we can continue to make sure our vaccination rate goes up. That's why we're doing this. That's why we think this is so important. This is not about one person or one branch having power. This is about shared power based on the law that we passed here this year in this chamber. This is about working together. Oh, and by the way, I remember, I'm sure everybody else did, we had a very productive legislative session this year. Passed a 2-year budget on a bipartisan basis. We passed a lot of bills, some partisan, some bipartisan. I don't think anybody thinks that we didn't do our job this year. But we're going to continue to provide the tools to the governor to make sure that we can keep people safe. Madam President, I would ask that my colleagues vote yes on this resolution. To me, this is common sense. It's the right thing to do. This is about keeping our schools open and safe. This is about ensuring that people over 65 can get the vaccine. This is ensuring that our state workers are safe and healthy. This is about ensuring that we continue to lead the nation with high vaccination rates, low infection rates, and that we can put our lives in a place that is about as normal as possible, given this global pandemic that we're all in right now. We know the tools that work for us because they've been working. The pandemic knows no expiration date. It doesn't say, oh, September 30th, I think I'll just go away. We've got to continue to be strong and nimble and able to react to whatever is out there. Because remember, back in July, when everyone was saying, this thing is behind us, it's in the rearview mirror, many of us were hoping that was the case. The Delta scourge came around and destroyed a lot of dreams that people had about Corona being in the rearview mirror. So thankfully, we had this ability. It kept our state healthy and safe. So, Madam President, I urge my colleagues to vote yes on this, to acknowledge the fact that what we've done has been working and will continue to work, and that we will always work together for the best interest of the state of Connecticut. Thank you.